Hello, my name is Brian, and I'm a first-year medical student at the University of California, Irvine. Today I'd like to talk to you a little bit about congestive heart failure. Now, congestive heart failure is a very important topic for us to discuss. It's in fact the most common form of hospitalization or common reason of hospitalization for people over the age of 65. And congestive heart failure can come on for several reasons, but one thing mainly to remember is that heart failure is when the heart just fails to function properly. It fails to generate the pump action that we need it to generate. There could be many causes of it. We will discuss those today. As you know, we have a right and a left-sided heart, and they can fail to relax. That will be a diastolic heart failure. They can also fail to contract and pump, and that could be a systolic heart failure. Today we're going to focus more on the systolic heart failure, where the heart is failing to generate enough pump action to meet the blood flow requirements of the body. And in the next few videos, we're going to go ahead and talk about the causes, the signs and the symptoms, and the way to diagnose it and then treat it. Now, remember, the heart is a muscle pump, and in order for the heart to be able to do its job, just like any muscle, it needs to generate force. In order to do that, remember the heart is built up of these muscle cells, or what we call myocardium. Now, it's important to distinguish heart failure from a heart attack or heart disease. In fact, those are precipitating causes of heart failure. So a heart attack or an MI, a myocardial infarction, is one of the most common precipitating causes of heart failure. Another cause could be coronary artery disease, where you have stenosed or narrowed vessels that are supplying blood to the heart, such that the heart is unable to get the oxygen it needs to pump properly. This could cause damage. 3, we also have high blood pressure, which also can be a cause of heart failure. Now, what do all 3 of these have in common? Well, they all lead, and part of their effects is leading to a weaker heart. And when you have a weaker heart, we'll no longer be able to generate that sufficient pump action, that sufficient force to meet blood flow requirements of the body, to pump enough blood up and into the tissues, and then we will see all sorts of problems associated with this. And these problems we will be going over in the rest of the video, and these are the signs and the symptoms. So the things that we're going to be able to see in a patient who's suffering from heart failure. So in order to help us understand what's going to go on in a body that has a failing blood pump or failing heart, I like to use the analogy of a failing oil pump in a car. Now, the oil pump, we know, is used or is vital for delivering and pumping oil throughout the car in order to lubricate the fast-moving parts of the car. If this pump begins to fail, 2 things are going to happen. 1, you're going to have a decreased amount of oil flowing through the car, and 2, you're going to have a collection of oil in the oil pan, and it'll just be sitting there doing nothing. That's kind of the way I hope we can think about heart failure, in that when you have a failing pump, a weaker pump, you're going to have a decrease in the output of the heart. We like to call it decreased cardiac output. And there'll be a whole set of symptoms associated with this, and we'll go over this in a moment. But 2, as I kind of mentioned with the oil pump, you're going to have a backup. So you'll have fluid backup, so backup of the blood. And in our bodies, in the circulatory system, if that blood is not being effectively pumped out by the left heart, well, it's going to back up into the lungs, and then even back into the venous circulation on the right side of our body. And that's going to cause a lot of symptoms that we associate with this congestive part of the name congestive heart failure. So we'll talk about those briefly in a moment too. But so hopefully we can understand, that these 2 things are independent of each other and will generate completely distinct symptoms that we're going to see in patients that are suffering from heart failure. So the first one I'd like to talk about in terms of the decrease in output, and as we all kind of beating the dead horse here, the blood is responsible for pumping oxygen. So when you have a decreased cardiac output, you're going to have a decreased oxygen delivery to our tissues. And that, as you can imagine, is not good and will cause symptoms. And one of the symptoms that I hope we can all kind of tattoo on our cortex here is fatigue. Patients with heart failure are going to suffer from fatigue because not enough oxygen is getting to the muscles. In addition, we'll see they might be confused, so confusion due to not enough oxygen getting to the brain. We may also see that these patients appear pale because not enough blood is getting to their skin. The next set of symptoms we can associate with is going to be due to a decrease in blood pressure. Now, blood pressure is something that we won't get into too much in this video, maybe a little bit more in the next, but if you're interested, you should look at all the other videos that the Khan Academy has put up corresponding to this issue of blood pressure. But as you can imagine, when you have a decrease in this force generated by the heart, it's not going to create enough pressure. Kind of like an oil pump not working as well, won't create sufficient pressure to drive oil through a car engine. When you have a decrease in blood pressure, our body is going to react to that, and a normal reaction would be an increase in the activity of the sympathetic branch of our nervous system, which is very reliable, we call it the gas pedal, in order to kind of rev our body up to maintain the blood pressure, because we know that blood pressure is very important for getting the blood around our body. So some of the things that the sympathetic branch is going to cause is an increase in heart rate. So in patients that are suffering from congestive heart failure, they might have a sustained heart rate increase. And another thing that the sympathetic will do, and that can help us kind of identify, or something we should see in patients with heart failure, is dilated pupils. Finally, when you have a decrease in the amount of blood that's moving around in the systemic circulation, you'll have a decrease in the amount of blood that's reaching the kidney. And the kidneys, as we know, are very big players in the production of urine. So, in fact, with a decreased flow to the kidney, you'll have a decreased urine production. So you're going to be peeing less. And that's a sign of someone suffering from heart failure. And actually, this aspect of the decreased blood to the kidneys is something that we're going to see and talk about a lot more in the next video. And it's a huge contributor to a lot of the problems and the progression of heart failure. And we'll talk about that more in the next video. So now I'd like to move on to the symptoms we're going to see in accordance with this kind of fluid backup. So as I've kind of reiterated here, when you have a decreased pump action, just like in a car, you're going to have a car engine failing, an oil pump failing to pump oil throughout the body, throughout the car. Getting mixed up with my analogies here. You're going to have a lot of oil sitting there in the oil pan, not doing much. And just like similarly in the body, we're going to find blood and fluid is going to get all caught up in our lungs, and that's going to cause congestion. And so we like to call this pulmonary congestion. And this pulmonary congestion is going to cause all sorts of problems. And things that are going to be very apparent to us on physical exam, one of which would be crackles upon inhalation. So if a person was going to breathe, you'd hear crackles because of the fluid in the lungs. With this fluid in the lungs, it's going to decrease the ability for oxygen to diffuse into the blood, and that's a bad thing. It can cause shortness of breath, where our body feels like it's not getting enough oxygen. And that can occur even worse when the patient's lying down. When the patient's lying down, more fluid will end up in the lungs just due to gravity. So these patients will often have to sleep being propped up on pillows. So that's another thing to note. If it worsens when lying down, so a common patient with congestive heart failure found in the hospital will be, actually propped up on pillows. So that's the pulmonary congestion, and those are things that you should be aware of when you're doing an exam or observing a patient with heart failure. But beyond the lungs, there's going to be systemic backup, so backup of blood beyond the right ventricle, right atrium, and into the venous circulation. So we'll call that systemic backup. And this will also kind of create a set of symptoms and signs that we'll see, and one of which will be jugular veins, so the veins in your neck will distend, will expand, will bulge, and we call that jugular venous distension. So this is something that you can look for on exam. In addition, we're going to see edema or peripheral swelling. The peripheral swelling you will either see in the ankles or in the hind region if they're bedridden. So the ankles, if they're going to be walking around, gravity is going to pull that fluid that's been backed up down towards their feet, and it's going to swell. In addition, you'll probably see fluid in the abdomen, so abdominal swelling. And once again, that's due to this fluid backup. This fluid, if it's not going to be pumped forward because the heart's unable to do so, it's going to back up, and it's going to cause these symptoms. So the next video, we're going to go ahead and start talking about more of the mechanisms, the pathophysiology behind congestive heart failure, and we'll understand why and how it has the potential to worsen and progress, and we'll learn how to diagnose it, and then go ahead and start treating it. So see you then.